Because this training session is relatively short, we could not possibly cover all circumstances that would require first aid. However, we will cover some of the most common life-threatening situations you may encounter. That doesn't mean that you should not try to make the victim as comfortable as possible while waiting, but even then, you have to be careful. For example, if you were to move a victim who has a serious back or neck injury, you could cause serious permanent injury. When responding to a victim, take a few seconds to quickly inspect the area. Remain calm as you take charge of the situation, and act quickly but efficiently. Decide as soon as possible what has to be done and which one of the casualty's injuries needs attention first. Shock can develop as a result of sudden illness or injury. When the circulatory system is unable to get enough blood to the vital organs, the body goes into shock. Sometimes even a mild injury can lead to shock. Shock can result from trauma, heat stroke, allergic reactions, severe infection, poisoning, or other causes. Let's go over some of the various signs and symptoms that may appear in a person experiencing shock. Cover the nose with a loose, dry, sterile dressing. Keep the victim quiet, sitting with head tilted forward to prevent blood going down the back of the throat. Pinch the nose shut, unless there is a fracture. Place ice or cold packs to the bridge of the nose or put pressure on the upper lip just below the nose. There are two ways to immobilize a fracture. Tie the injured limb to a stiff object or fasten it to some other part of the body. Again, never make it too tight because this could cut off the blood circulation. If you are in a dangerous area such as a fire and decide to move the victim, do it quickly and gently to a safe area where proper first aid can be administered. Remember, you cannot help the victim if you become one yourself. Suppose you are on your post around lunchtime and you see someone grabbing at their throat and pointing to their throat. This is a natural reaction, and almost always is the same for someone in distress that is choking on something. Then quickly but methodically position yourself behind the person. Wrap your arms around their waist. Place one of your feet between his or her legs like this, so you can support their body if they lose consciousness. Make a fist with one hand. Place the thumb side of your fist against the person's abdomen here. Place one hand on the person's forehead and place two fingers of your other hand under the bony part of their chin. Place the heel of one hand on the stomach, slightly above the navel, but below the notch in the center of the chest. Interlock your hands as we showed you earlier, interlocking the fingers of both hands. Lock your elbows and use the weight of your body and the heel of your hand to give 5 quick thrusts inward and upward into the stomach.